Depression is an issue for a lot more people than you might think. About 20% of today's adolescents suffer from depression. It is one of the most overlooked and undertreated psychological disorders among young people ages 10 to 19. Perhaps someone around you is depressed and in need of your help and you don't even know it. This is an issue and we need to take action. We must look for the signs of depression and be willing to reach out to those who are affected by it.
In adolescence, there's a much higher rate of depression being underdiagnosed and undertreated. It's important to understand that depression can't be ignored or taken lightly. If neglected, it can have a negative impact on schooling, educational attainment, and relationships. It can also go so far as to have lasting effects that negatively impact health and functioning later in adulthood. Sometimes depression in adolescence can even be a sign of chronic depression.
Some adolescents are more likely to suffer from depression than their peers. Many factors that can lead to increased risk are family-related. If they have a history of depression in the family, then they have a higher chance of becoming depressed. They also may have an increased risk resulting from the death of a loved one or a conflict in the family. Poor relationships and lack of communication among parents and children can also result in adolescent depression. Some health-related factors can include having learning disabilities or various other medical conditions. Lastly, an adolescent might be at increased risk of depression if they have a breakup in a romantic relationship, misuse substances, or suffer from trauma.
Sometimes depression can be easy to spot, but other times it's not as obvious. In order to determine whether or not someone we know is depressed, we have to look for warning signs. There are several warning signs that point to depression, some of which include sadness, hopelessness, anger, and frequent crying. Additional warning signs can be described as losing interest in hanging out with friends and family, or even losing interest in general day-to-day activities. There are also smaller details that demand your attention, such as changes in their eating and sleeping habits. Sometimes when a person's depressed, they may eat significantly less or maybe not at all, resulting in significant weight loss. A lack of energy and motivation, restlessness, or difficulty concentrating can also point towards depression. Of course, there are more obvious signs such as talking about expressed feelings of worthlessness and even thoughts of death.
When dealing with someone who suffers from depression, it is important not to tell them to just get over it and move on. It's a real disease that affects the brain and not just a flaw in character. Many times, depression in adolescence is viewed as a teenager going through a moody stage. Sometimes the way we tend to react is to tell them to just cheer up or put on a happy face. In reality, this is not providing any help and their condition shouldn't be taken lightly. The best thing we can do to help someone who is suffering from depression is to love them and offer them the support they need. It is also important to read brochures or other information to help educate yourself on the topic.
Although you can provide your love and support, it's important to remember that you cannot fix his or her problems and that the person you care about needs real help. You should encourage them to seek out professional help and make sure they do not feel ashamed or afraid to ask to receive help. You can offer to schedule their appointments, help them come up with questions they want to ask, or even tag along with them to the appointment. Sometimes family members of the person who's suffering need to attend the appointments to receive help in dealing with the situation. Even after taking someone to get help, you can't expect them to get better just overnight. It's crucial that we have realistic expectations. To make sure they continue to improve, you should continue encouraging them to see their treatment plan to the end.
If adolescent depression is not treated, it may result in suicide. 1 in every 200 people suffering from depression commit suicide. It's the third leading cause of death among adolescents. This is why it is so essential that we take action against depression now. You must remember, in the case that someone who you are helping fight depression commits suicide, it's crucial to not blame yourself and to recognize you did what you could to help. Depression is hard to overcome, and some people are unable to do so despite the help that is provided.
The most important thing you need to remember if you think someone you know is suffering from depression is to take action. Don't just be a bystander. Speak up and help them get the help they need before things get fatal.